All right, so again, welcome everybody. This is a 45-minute webinar, which is a introduction to Embodia for pelvic health pros. A lot of what we're going to go through today is pelvic health content. Thank you for answering the polls. It's helpful just to get a sense of who's here and what you're interested in learning. A lot of what we're going to go over is pelvic health content, and then there's also a lot that applies to ortho and practitioners in all areas of practice. My name is Maggie Bergeron. I am a PT and one of the co-founders of Embodia, and I'm going to be taking you through this webinar today. This is a part of a webinar series that we're currently running called Let's Talk Pelvic Health. And this one is specific to Embodia. So this is really about features and functionality on Embodia. The rest of the series is being taught or presented to you by numerous different instructors across lots of different fantastic topics in pelvic health. You're welcome to put your questions in the chat or the Q&A. I'm going to keep an eye on both as we go, and I'll answer questions as they come up because it'll probably be, if you have a question, it's probably relevant to what I'm talking about at that time. As you saw, I'm streaming this to YouTube, so it's going to be left up on our YouTube channel. And you're welcome to download these slides if you want. You can use that QR code. The slides are on the webinar page where you registered. So the agenda, this is what we're going to go through. I'm going to give a brief introduction to Embodia, and then we're going to go through an overview of the dashboard. We're going to look at HEP exercises, patient education. We're going to look at pelvic health content, questionnaires. I'm going to show you the bladder and fiber diary feature, as well as the new custom diary feature that we just released this week, which allows you to build your own diaries. We'll have a look at scheduling and online booking, as well as billing, and then finally the patient experience. As we go, I will switch it up if you have specific questions or if there's something that you want to see, then I'm happy to do that for you as well. Embodia is an all-in-one platform. So we have everything from online continuing education to a complete practice management system, telerehab, home exercise programs, questionnaires, and outcome measures, as well as a few other things that I'm going to briefly show you that is quite unique to Embodia. And what I thought might be interesting or maybe just nice to know is we did not start as an all-in-one platform. We started over here in 2014, the end of 2014. Ellie, my co-founder, and I started really as a way for me to share customized exercise programs with my patients. So as a PT, I'm a terrible artist. I'm not very good at drawing stick figures, and I was really tired of doing that. So Ellie suggested that we try building something for my patients, which would allow me to upload my own videos to an app. My patients could track it between their appointments, and I could communicate with them on a secure platform, which is called remote patient monitoring, with the idea of helping them help themselves. So providing resources, high quality resources that they could actually watch and not have to try to decipher my stick figure drawings, or record on their phone and then have to flip through finding their program and remembering to do it. So we built a way that reminded patients of what they were meant to do and be able to track it. That's where we started. And then the next thing we built was Embodia Academy, which is a learning management system. So that's where we host all of our online continuing education. We host on-demand courses as well as live online courses. Next, we built something called Private Academy. This allows large organizations, universities, hospital networks, franchised clinics, or even large clinics to host their own internal team training. Then we added two-way messaging, and we also added questionnaires around this time. And then we added Clinic Academy. I am going to talk a little bit about Clinic Academy tonight because this has really grown over the last couple of years. There's quite a bit of interest in it. If you're familiar with things like Thinkific or maybe Udemy, but Thinkific really is the one that we get compared to the most. Clinic Academy allows you to host your own courses and sell them or provide them for free to your patients and the general public. You can also sell them using memberships or packages. And then we added telerehab. This was not to bring up the pandemic, but this was right at the start of the pandemic. We added telerehab for one-on-one and group sessions. And following the pandemic, we built a complete practice management system. We also built a way to host classes, so to manage virtual and in-person classes, sell packages and memberships, build your own diaries. Here we are today. And if you're curious about what's coming next, we're about to release what's called a change log. So you can see a timeline of new features and improvements basically in real time on Embodia. And then this one for the Ontario folks, if there's Ontario folks here, we are in the process of building an HCI integration so that you can do all HCI billing on Embodia. Just briefly, because we are an all-in-one platform, we've had decided to break our membership into 3 tiers to make it as accessible as possible, because we know that there are certainly clinics and clinicians who use just education, just patient engagement, and just practice management. There's also a free tier. You might be using that right now. We have a free option so you can log in and basically take Connet. And then there's 3 tiers outlined here. The add-ons I mentioned are Clinic Academy and Private Academy. And again, Clinic Academy allows you to create and sell your own online courses and exercise programs to patients in the general public. You can, of course, provide them for free if you prefer. Or you can have some courses that are paid, some that are free. You can have some that are in a membership, some outside of the membership. And it's your own branded academy. And Private Academy, if there's any large clinics, this would be more for you. It's a way of consolidating your organization's content, like training, policies, documents, videos, all the things that you need to train your team internally. You can host that in one place, and it does include full analytics. So that's the end of those slides there. We're going to hop into a demo. Just before we get into how Embodia works, I'm going to show you a few examples of some clinic academies. So Kids Physio hosts their courses. They've actually set them up as tracks, learning tracks. So this track has lots of different courses in them. You can see that they're selling them. These are, again, for patients of the general public. The Running Physio, for example, currently has 2 courses that they're hosting. And you'll notice that the page will change. The buttons on the page will change. Of course, the branding will change, but the buttons that appear depend on how the clinic is using Embodia. Again, because we're an all-in-one platform, there's lots of features, there's lots of functionality, and there's lots of flexibility, which you're going to see today as well. So in this example, this clinic is using it for practice management. So you can book appointments online. You can view their courses. They're also selling some sort of membership related to their academy. In this case, again, practice management, but also selling packages for their services. So just to give you an idea of what the online booking portal looks like and the flexibility and options that are available there. Okay. Yeah, so I see there's a question here. If you were to compare yourself to Jane's software, what would you say your strengths and weaknesses are? The thing I can tell you, what we hear from those who either switch from Jane or who decide to use Embodia over Jane, the reason that folks say that they'll choose Embodia is because we are an all-in-one platform. So we have a complete practice management system, which offers everything that Jane does: charting, billing, scheduling, online booking. If you're in Canada, we do have an integration with TELUS eClaims. An advantage soon is going to be that we do offer a full integration with HCI if you're in Ontario. And for the US clinicians here, we have a super bill feature. Now, one weakness or one type of clinic that is not going to use Embodia, and we don't have it on our roadmap to build, is US-based practitioners who do insurance billing. So we don't have an integration with the insurance system in the US. So that's just a limitation on our side. And to be honest, we're not sure if we're going to build it. It is a very large integration. So that's definitely one difference. You'll see that we probably use different terminology than Jane. I'm not 100% sure, but most platforms are going to use some different terminology. But because we have an all-in-one platform, which is a fully integrated built-in HEP system, Jane also has telerehab, but the HEP side, the ConEd side, complete practice management, and then these kind of add-ons, the ability to sell courses, the ability to host classes is definitely a difference. Is this available for the Caribbean region? Absolutely. You can It can be used anywhere in the world. If you have questions about security or privacy concerns or anything like that, that would be something to consider, but just reach out to us and we're happy to assist you. We also have our terms and conditions and our privacy policy published on our website. But in general, Embodia can be used anywhere in the world. Great questions so far. Feel free to keep putting them in there. All right. Sign out of my admin account there. All right, here we go. So from the Embodia landing page, I'm on my computer right now. So I'm on the web version of Embodia. There is a mobile app that's available. It's only for paid members. So if you're using Embodia for free right now, you can't use the mobile app. The app you can download from the Apple Store and the Google Play Store. It is a pared down version. So it's really meant for HEP. It's meant for prescribing exercises on the go. It does have one feature that we don't have on the web version, which is the ability to record your patients in session. So if you were coaching a patient with an exercise or teaching them how to do an exercise and you wanted to record them doing that, you absolutely can on the mobile app and then prescribe it just to that patient. Those videos are hosted on a totally different server. There's a lot of privacy and security rules around that, of course, with recording patients. So we're very mindful of that. But for the purpose of today's demo, we're going to use the web version of Embodia. And on the sign in here, we can see that there's 3 options: practitioner, patient, and clinic admin. We're going to start on the practitioner side. And at the end, we're going to look at the patient side. If you're a clinic that has front desk staff or admin, you can have clinic admins on your account, and these are free accounts. Okay, so there's no fee to add clinic admins. You can have as many as you'd like. Similarly, patients don't pay to use Embodia unless you're, of course, if you're selling something on Embodia like a course, then patients may pay for that. But in general, patients are not paying Embodia at all. We don't market to patients. We don't contact patients, with the exception of automated emails that are going out based on the actions that you, the clinician, take. So we're going to start on the practitioner sign-in page here. All right. And we're first going to go through a overview of the dashboard. So if you're logged into your Embodia account right now, you might see different things on your account based on how you're using it. What you see is going to automatically change based on the type of account or the type of membership that you have on Embodia. Everybody, though, is going to have this in the top right-hand corner. This is helpful for everybody to know. It's where you can find your information. You can update your email address. You can update your name and your password. You can add your signature. This would be for those who are using our practice management system. Particularly US users tend to add their signature, but anybody using the practice management can. This would be helpful on things like invoices. Professional licenses. You can add your professional licenses here. Again, this is for practice management. So you can have as many licenses as you'd like, and then you can set it so that some of your services or certain services are associated with the correct license so that the correct information is showing up on your invoices. And if you happen to be a student or a new grad, add your graduation evidence. We're working on adding more discounts for students and new grads to encourage Con Ed. There's another question here. Can you transfer existing files from a different platform to this platform? If this platform is no longer a viable option, what then can you access from 3 devices simultaneously? Okay, lots of questions. Yes, you can transfer existing files from a different platform. I'm going to point everybody now actually to our guides. We have lots of guides, and I'll share this link in the chat as well. These guides are meant to help you learn and know or understand how Embodia works. So we have both export tools, exporting patient data, so you can export your data at any time, and we have import tools, so you can import and export your data. If you're importing from an existing system, then we'll work with you to make sure that the import is correct. but what you import is completely dependent on what you can export from your existing system. We have had folks move from Jane, from Medexa, Practice Perfect, Clinic Master, PT Everywhere for the US folks, Intake Q. So lots of systems. So we've seen lots of imports, and generally the data is reasonable. You can import patients, you can import charts, but we would work with you on that. If this platform is no longer a viable option, what then? You have a read-only version. So we don't actually remove your access. What happens if you cancel is you'll be able to log in and you get a read-only version. So you would still be able to export your information. If that ever changed for any reason, we would let you know with lots of notice. And can you access from 3 devices simultaneously? Yeah, you can log into Embodia from multiple devices. If you have any other questions, let me know, or if that didn't answer it. Okay, I'm just going to drop this here into the chat because it is helpful if you just want to type in and find answers to things. That's where you'll find most of the answers you're looking for. We also have separate guides that are for patients as well. Mandy, it's only for super bills. Yeah, it's only for super bills. We don't have an integration with Medicare or insurance in the US. And like I said, we're not planning on it in at least the short term. So if you need those integrations, then Embodia is not the right practice management system for you, at least not right now. Okay, we're going to go back to our avatar up here, my settings. I just want to point you to this because there are a variety of settings that you can choose on your account. License on certificate is related to our Con Ed. We are in the process of getting more courses approved for CEUs in the US, South Africa, a variety of countries. If you're in Canada and you're a PT, then you don't need to worry about that. And then there's a variety of settings here, including the ability to enable messaging. So if you wanted to have two-way messaging with your patients or allow patients to attach notes when completing an exercise, you can do that. And then there's a variety of notification options that you can choose. Also, privacy and security, we have a default timeout. So if your account is inactive for 60 minutes, we'll automatically log you out, but you can change that to whatever timeout you would like. And then across the top here, so across the top, we have education. This is all related to Con Ed. Embodia Academies are online on-demand courses, webinars are live courses. We do have a blog, and you can go to your portfolio at any time and filter to download or filter to see what courses you've taken. You can download them if you'd like. My Clinic, this is largely related to practice management. This is where a lot of the setup happens for those using the practice management system. And we do have an onboarding checklist, as well as setting up your services, setting up your billing, like how you're going to get paid, contact info and branding, and a variety of other setup features here. To the person who asked about the differences between Embodia and Jane, and I would say actually Embodia and most practice management systems, one of the biggest differences is that our practice management system, or one of the other differences, is our practice management system is built around clinical cases, and we have a function called patient properties. So instead of building our reports, which we can just have a brief look at here, instead of building our reports around a patient level, we have at a macro level, patient level, and then underneath of that, clinical cases. So if you wanted to be able to see how many patients have been discharged from care, whether it was successful discharge or self-discharge, you can do that. You can see clients who haven't rebooked. You can see clinical case stats. So this is related to how many patients are being seen on an ongoing basis, how many have been completed, how many were successful, and how many were self-discharge. And then if there were more than one practitioner in this clinic, you would be able to see all of the practitioners and what their stats look like. This is helpful from a reporting level because probably most of you have patients who come and go, right? We have patients who come in for a shoulder injury and then successful discharge. They're great, they're on their way, and then maybe they come back next year for incontinence. So then you can set up a separate clinical case to basically get reporting that is not just total in the lifetime, how many times does this patient come in, but how many times have they actually come in for each clinical case and what was the success rate of that clinical case. Charting, that is also part of practice management. There are chart templates, and of course you can see all of your charts. I will just point out one of the reports that people don't, it's very helpful, but nobody really becomes a PT because they want a chart. Patient chart stats, you can go in and actually pull up, if you're really behind on charts, how many total charts you have, how many were signed, how many are in draft, and how many appointments are uncharted. So if you just quickly needed to find how many charts were left to do, you could click here and see all of the consults that you needed to do your charting for. Consults is everything related to consults. This includes telerehab and in person. You can see here that there is a waitlist feature, so you can manage your waitlist. Something else that we have is called booking requests. So on online booking, if you, let's have a look at it actually. In your online booking, you can choose to enable something called a booking request. So if a patient is looking at your online booking page and they're not sure what they're trying to book for or what they need, or they can't find the time that they're looking for, they could submit a request and this will go to you. So it results in fewer new patients, typically new patients, not actually booking in because they couldn't find what they're looking for on your online booking page. Yeah, is it good for home-based single practitioner practices? Absolutely. We have lots of single kind of solopreneurs, solo practitioners, home-based, mobile, PT, virtual only, but lots of individual practitioners. And one of the reasons why we hear that individual or the sole practitioners sign up is because our pricing is so competitive. It's $45 per month. Moving along here, HEP. And my patients. We're going to spend some time right now in HEP. So I'm going to go to the exercise section here. There was quite a good number of you who asked to see the HEP features. So again, this is where we started and it still does exist. In our exercise library, there's many different options here. The order of the exercise is in the library are going to be ordered by the ones that you prescribe the most. You can also star exercises so that they become your favorites. You can search for exercises. You can search using the general search bar. You can pull up an exercise. Our content is video-based. You can watch it and you can add it to a program. There's additional tabs here. So if you uploaded your own exercises here, they'll appear here for you in this tab. So it's organized. If you are connected to a clinic, you can create a clinic library of exercises. And if you're taking any courses on Embodia that have exercises in them, then you'll be able to find them in this tab. And all exercises will appear here for you. The other neat thing here is that you can click on the name of the person or the group who's uploaded this exercise or created this exercise, and will pull up all of their exercises for you. Okay, so for example, Pelvic Health Solutions, we can pull up all of their exercises so that you can see what they have in the library. There are many of our instructors who have contributed to our library, and we also have a standard, more like a standard ortho library of exercises. We have a seniors health and a pediatric library and a small neuro library of exercises. And again, you can click on, for example, Embodia Team, and you're going to pull up all of the exercises that Embodia has created. Very similar in the education library. You're going to see a library of content. You can upload your own. And when you upload your own, whether it's exercises or education, it can be video-based, text, images, links, whatever you'd like. Okay? And you're welcome to use whatever you find in our library. Carolyn Van Dyken has put together this fantastic series of pain education videos, which you can easily share with your patients. When you click share, you'll be asked to select patient. If you wanted to add notes for your patient, you can do that. And then we'll tell you that it's been shared. Share more. I just see a few comments here and questions. A yoga therapist. Yeah, we do have yoga therapists who use Embodia. And actually, yoga therapists tend to use our classes feature quite a bit. But absolutely, this is a platform for yoga therapists. If anybody wants to talk afterwards, I'm going to give you our link to book a demo. So if you want to ask like individual questions or go through things more specifically to your practice, then we're happy to do that as well afterwards. Okay, how does one create an exercise program for a specific patient without ending up in the list on the top right hand of the screen? Let's go through these steps. So from the exercise library, you're first going to pick your exercises. I'm just going to add some random exercises to the program. Okay? Up here, we see the programs section. So once you've added your exercises, you're going to finish creating the program. So you're going to give your specific instructions for this patient. You can set individual instructions. So I can set, let's say, calves on the stool, and I have default instructions. So there's ways of making this faster. I'm not going to be able to show you all the features of Embodia today, but there are ways of making this faster, including default instructions, which is why this has been filled out. The only thing that you need to fill in is daily frequency. How many times in the day is this patient doing this exercise? And if you put 2 times per day, they're going to get 2 reminders saying it's time to do your exercises, and it's going to show up twice on their dashboard. Now, patients can change the time that they receive those notifications. They can turn them off, of course, like any notification. And on your side, you can change the time if you want as well. In the more options, there's a drop down of saying, how long is this going to be in their program? Do you want them to do it for 3 weeks, months, years? We'll say 3 weeks. What days of the week? Are there sets and reps? Probably for calves on the stool, not, but hold. This is also something unique. We added breaths, so you can do a hold and breaths rather than just seconds and minutes. And you can make notes. Use a pillow maybe under your head. And you can see there's even a save as default. So if this was the common prescription that you gave for this exercise, you could just save it as the default for this exercise. And maybe these 2 exercises have the same prescription. So we can just use this big button here, click it, and we're going to set the instruction for both of them at the same time. So again, making it faster. I'm going to send to patient. There you go. You can give the exercise program a name if you want. Go back. You can choose to allow your patients to track their symptoms using the visual analog scale or not. If you have colleagues, if you have a clinic account on Embodia and you work with other colleagues, then you can allow your colleagues to modify the program. And freestyle, this is a feature. If you want to learn more about it, again, we can chat afterwards. But essentially, if you didn't want to say how many times per day or what days of the week, we have a feature called freestyle program. Okay. When you prescribe it, you're going to be brought to the program page. So if we look over here, we can see that I'm under Jane Doe's profile in her programs, and we're in her low back program. Whenever you prescribe something, it's not set in stone. Okay? So you can always come back and change it. The practice management system is $45 per month. I'm just reading the question in the chat here. Practice management is $45 per month. We don't offer an annual option for practice management because the number of clinicians may vary. Like you may hire or people may leave the clinic, whatever it may be. So the price will adjust for you month to month so that you're not overpaying for what you're using. It's just going to adjust on a month to month, and you can cancel at any time. Okay, so it's just $45 per month. If you do have a clinic, there are clinic discounts available, and they start at 3 practitioners. So after 3 practitioners, there's a discount for all the membership tiers. Okay. Just pull up. Got rid of the chat and the Q&A there. Okay. So again, for the exercise program, it's not set in stone. You can always come back and modify it. And you can also get a program summary. There's a bunch of other buttons down here that you can add exercises, you can print it, you can get a program summary, you can view it in a calendar view. And another time-saving feature is turn it into a template. So if this is something you often prescribe, you can just turn it into a template. And templates are a great way to prescribe exercises. I went to HEP and templates. These are pre-built templates. You can just simply click prescribe. And let's see if we have another Jane Doe 2. And then it's prescribed. So that's definitely the faster way of prescribing things if you have preset templates. Okay. Now, the other thing that's available are called resource packages on Embodia Academy. There is something called resource packages. Some of them are free, some of them are paid. These are offered by our instructors. And this is actually Carolyn's pain education package. A resource package contains patient education, patient exercises. This one is actually free. This is a good example to look at. I'll put it in the chat. Oops. And these are free resources. Okay, so some of our instructors said, yep, I have lots of like exercises and content that I'd like to share. So they've put them together and you can purchase them. They are single purchases, or if they're free, then they're just free. If you do have a resource package, let's see if we have this one, no. If you do have a resource package, you will be able to share the content from the resource package page, but all the content will also be added into your exercise and education library for you. Okay. We're going to hop over to patients here because we're going to look at the diary feature. So quite a pelvic specific. We're going to look at diary and questionnaires as a feature. Okay. Here we can see the patient list. So there's a list of patients that we have here. We can add a patient, we can import patients. And we'll just use Jane Doe as an example here. Every patient has a profile, which includes a summary. What is included on the summary, you can tailor. So we've added a whole bunch of additional information here, which is completely tailored to your account. Programs are all exercise programs, active and completed. Charting, it's all charts. We recently added this actually, so there's an easy way to view all uploaded files. So if you've uploaded like imaging or past charts, there's a really easy way to go and find them. Consults, all upcoming consults, all completed consults, clinical cases. So this is again, one of the unique features about Embodia. You can set up clinical cases for your patients, and each clinical case can have you'll see the number of visits when it started, and you can mark it if it was completed or not. So waitlist feature, and then there's consent forms. So there's an easy spot for you to come in and see what consent forms have been shared with this patient and which ones have been accepted. You can, of course, click on this and you would be able to view it. If you wanted to, you could print it. Patient education. So this is education specifically shared with this patient. We'll come back to progress. Billing, this is everything related to billing for this patient. So invoices, if you were tracking insurance policies, you can do that under the policies section here. Invoices are all invoices for this patient. And you can see, again, we're giving a summary. So what was the invoice date, subtotal, there's taxes, was it sent to the patient, status, draft. Okay. And if you're using super bills, there's going to be a super bill feature that's on the invoice for you. There's also a way of setting defaults for your super bills so that it automatically populates. In communication, we show you all email communication. These are the automated emails that would go to a patient, like reminders for appointments, letting them know a new program has been prescribed. You can see all of that, and there's a little eye icon here. So if you wanted to see what was actually included in the email, you can click on it and see it. And we do have an SMS feature. So if you wanted to send text reminders to your patients, you can set that up as well. Text is, or the SMS feature is only available in our tier 3 practice management option or tier. Now, back to progress. There's several options here. Progress diary is something that was actually requested by patients. You probably have patients who are like really keen and into their program and want to track everything. So we had some patients who asked us if we could add a way for them just to add a diary, like just a plain progress diary, which we did. And patients can fill in that diary and they can choose to share it with you or just keep it for themselves as a way of tracking anything that they want, just basically taking notes on how they're doing. Questionnaires. Questionnaires is a broad term that we use to describe anything that the patient may fill out. This could include, as you can see, outcome measures like the DAS-21. We do have lots of templates of these, so they're pre-built. And when a patient fills them out, it'll be scored for you. If it gets filled out more than once, you're going to see change over time. And then down here, you can see what they answered. Okay, so that's questionnaires in a nutshell. Patient-specific functional scale, if you wanted to share or have your patients track their goals, you can do that. And bladder and fiber diaries. So bladder and fiber diaries were already existing on Embodia. This is a way of sharing the diary with your patient, and they can fill it out digitally, so they don't have to carry like a piece of paper to the bathroom. We'll just have a look at an example. You can give it a title if you want. Start dates, you're going to say, we'll start today, and I'm going to have you track 4 or 5, oops, it's probably too much, 5 days. And then as they add entries, you'll be able to see it here, and there's a simple print button if you ever wanted to print it. Okay. Now, the new addition is diary questionnaires. So diary questionnaires allows you to build your own diary, whatever it may be. Again, this was a feature request, and we'll use sleep diary as an example. So I had built this as an example, very similar to bladder diary. You're choosing a start and end date and then clicking submit. And we're going to have a look at this from the patient side so you can see what it looks like. Okay. So again, patient can track whatever it is that you're asking them to track, and then you're going to see all of the entries here. The delete button will only exist if the patient hasn't filled it out yet. Once a patient started to fill something out, of course, it's important data, so we can't just delete it. But the edit button will still exist. Any other questions right now? Because we're going to hop over to the patient side. Yes, can you show this from the patient perspective? Perfect. That's what we're going to do right now. I'm going to log out here. I'm going to sign in as a patient. Okay. So here's our patient dashboard. Patients can use Embodia on the mobile app as well. Okay, so they can log in using their same credentials on the app as well as the web version. You can see today's date. This patient was asked to track their visual or their pain using the visual analog scale. We can add a bladder diary. So there's instructions here at the top. And just like the paper diary, they can add as many entries as they want. So the button doesn't go away, it just stays. They can continue to add to their bladder diary. Here's the sleep diary that I built. It's going to look a bit different because I built this with specific questions. So here's our entry date. It's going to populate based on when I clicked on that button. This is probably not very realistic, but anyways, we'll just say, here we go. So you can see that there's different types of questions here that I've built in. You can build it any way that you want. This is just giving you an example. Okay, and they'll be able to see what they wrote as their entry. Same thing, the button's not going to go away, so they could add more entries if they wanted to. And below we can see consults. This is any upcoming consults. Oh, good question, Katie. Our bladder diaries. Bladder diaries are available in tier 2 and 3. Okay, so if you also look at our pricing page, we tried to do as good of a job as possible to give you an overview of what's included in each. So here, outcome measures and questionnaires is included in our tier 2. And anything that's included in tier 2 is also included in tier 3. The tiers just build on top of each other. So bladder diaries are available in tier 2 as well as tier 3. Okay, back to our patient side here. So the patient's going to see any of their upcoming consults. We can click on this. It's going to bring us to the consult page. It's an in-person appointment, so we see the address. If there was a consent form attached to this consult, there would be a button here showing them or saying click here for the consent form so that they can sign it. Okay. And then down here, we can see their exercises. These are the exercises for the day. They can click on them. They can watch the video if they want to. They can see the prescription. They can say that they've done it, and they can add notes. And they can add notes if you've enabled notes on your account. Okay. If you have two-way messaging, you can reply to those notes as well. So if you've said, yes, I want to use two-way messaging, and a patient adds a note, you can reply to those notes. You can also be notified when somebody leaves notes on their program. There's also just a quick check here. So if somebody doesn't need to watch the video, they can just click the check mark here. It'll turn green, and it'll mark that they've completed the exercise. Along the side, here, the patient can see a history of all their consults. Something that's really important to us on Embodia is who owns the data. This is something that's important in technology, and something that is important for you to consider as well for any platform that you use. Who owns the data? Where is it stored? How is it managed? All very important. Embodia is PHIPAA, PIPEDA, and HIPAA compliant. Those are the things that a tech company needs to be compliant in terms of managing data. But for us, and as a PT, what I always wanted was for my patients to have more accountability, or even like the opportunity to have more responsibility and to really take charge of their rehab programs. So that was a large part of why we built Embodia initially, but this is also kind of throughout the platform. This means that practitioners, of course, own their own data, but we also believe that patients should have full transparency and be able to see all of their history. And just like we carry around our banking information, like you can log into your banking app and see your own banking information, we believe that patients should be able to carry around and see all of their health information. And ideally, hopefully in not too far off of a future, systems will actually integrate, like they'll talk to each other so that you're not like having to, carry imaging from one place to another, or call. And I've been a patient many times, and it's very frustrating as a patient to have to try to, quarterback for all of your health information. So what we do is provide patients full visibility and a full history of what's been shared or what they've done on their Embodia account. If you ever canceled your account, if you were using any tier 2 or tier 3, and you canceled, we don't remove patient access. They can still log in, and they'll have read-only versions as well. They can see their questionnaires. They can see what they've completed or not completed. If we go to the DAS 21, here's an example, they can complete it. If you have patients who you think are not tech savvy or don't want to use it, there is an option to actually complete questionnaires with your patient in session. So you can do it with them. I may not continue and fill this all out, but essentially when it's done, click submit. If there's missing fields that are required, they're going to be told that there's missing fields that are required to fill them out. Performance, this is all their past programs. Now this is a patient who's been a demo patient for quite a while. So you can see that she's had quite a few exercises, and she can see a summary of everything she's done. Diary and outcomes. So this is the progress diary I'd previously mentioned. Patient can add entries as they want. And as you can see, they can choose to share it with their practitioner. There's also the patient-specific functional scale, bladder diary, fiber diary, and other diaries that are all listed here. And this includes past and present ongoing things that they're meant to complete. Education. So they can watch or read any education that you share with them. The list always remains, so it doesn't go away. If there's something new, it's going to be in green and it'll say unread. my conversations. This is two-way messaging. So you can have a messaging conversation with your patient if you want to have two-way messaging enabled. Two-way messaging is available on the mobile app as well. If the patient's taking any courses, so this would be like in your academy, then they would be able to view them on here as well. And then finally, their profile. So this is just their information. They can change the video quality. Like if they're in an area with poor Wi-Fi, they can change the video quality. Any receipts, any invoices, and packages and memberships that they've purchased with you. Okay. I know that was fairly quick, that I just ran through the patient experience there. If you are using our tier 3 account, then it'll be branded, or our tier 3 membership, it'll be branded for you or with your branding and your contact information instead of Embodia's. Any questions? Anything that you want me to go back through? We're a few minutes over time, but I'm happy to stick around and answer more questions if there are any, or if there's anything specifically that you would like to see. I had planned on showing you the schedule, so we could do that. Okay, yeah, Stephanie, if you stop your membership, you still have the ability to log into your Embodia account, and you would have read-only versions of all of your information. So you'd still be able to see everything, you just wouldn't be able to add anything new. And we do have export tools, so you would be able to export your data. Let's have just a quick look. No problem. We often have, actually one of our team members on Embodia has a couple of young kids. So if you've ever done a demo with her, sometimes she has a kiddo interruption as well. How many practitioners are allowed to access? Each practitioner would have their own account. So if you're using Embodia as a clinic, you'll have, whoops. Oh yeah, we got to log back in as a practitioner, sorry. You will have the ability to invite your colleagues. So you can send an invite to add colleagues to your clinic. This is a manager feature. So the manager of the clinic can add the email address, and we just ask that you understand that this is a $45, or it's a per month per practitioner fee. And then again, the number of clinicians that you have, as it increases, as you have more practitioners, the greater the discount. And this information, like in terms of discounts, is available on our pricing page. But again, if you have specific questions, we can book a time to go through that together and have a chat, because I know we can't chat right now. I'm just talking kind of at you, but feel free to schedule a demo afterwards. What does a demo look like for single? Sorry, Brenna, I'm not sure I understand. What does a demo look like for single home practice? Maybe just clarify, like if you want to book a demo to see Embodia. The other thing I'll note, just maybe Brenna, while you're clarifying, is that we have something called a sandbox account. So if you do a demo with us, then we're going to send you afterwards login credentials where you can go and play in a sandbox, like a tech sandbox, so you can play around with the features. We definitely want folks to make the right decision. Making a decision about a practice management system is a really big decision. So we want to make sure that you're choosing the right one for you and for your practice. So we give you kind of like a demo account, essentially, that you can log into and play around with the features. How long would it take? How far? Oh, how long does it take to book a demo? We have one tomorrow at 11:45 and then some next week. I think that's what you're asking. That's our calendar. We just use this scheduler to book any demos that anybody wants. So you can find a time that works for you. Mandy, good question. We would love feedback on this, actually. So Mandy asked, do you have access to other shared evals, document templates from other practitioners? What we've done so far although we may end up switching to more of like our HEP model, where we do have kind of like this community sharing in the exercise and patient education library, right? The content in the exercise and education library is not just Embodia's. There's a lot of our instructors, there's even some clinics that we've allowed to upload, but we give permission to them to add to our library. If you have permission on your account, when you add something, you're going to be given the option, I want to make this exercise public. So all practitioners using it can view it and use it. But this is, again, permission-based. If you have a clinic, you'll have a clinic option to create a clinic library. At the moment, though, for our charting templates and for our intake forms and questionnaire templates, these are templates that we have built only. Now, a lot of them do come from practitioners or clinics requesting them. So yes, there are templates from other practitioners, but it doesn't say who it's from. Okay? These are our questionnaire templates. You're going to see that they're marked with either intake form, consent form, or outcome measure. Okay, just to give you a bit of an idea of what's in here. We're just about to add about 8 new ones that are all pelvic health focused by request. So we do take, if you've ever emailed us and have requested something, or if you're currently using Embodia, hopefully you know that we're quite responsive and that we take all requests very seriously, and we try to build based on what you'd like in the library. So hopefully that answers your question, Mandy. The answer is we do add to the library based on what folks send us, and as long as there's the copyright rights or IP rights for us to use it as a template. But at the moment, it's all Embodia building it and adding it to the library. It's the same for the charting. Okay. Yes. Okay. Deneen, are there automated reminder email call features? That depends on if I'm interpreting the question correctly. There are automated emails for patients. If you're talking about automated emails going out to patients, yes, there's quite a, patient appointment reminders. Yeah, and these are set up under something called consult settings. So we give a lot of functionality or flexibility for clinics to set it up the way that they want it to, which means, let's just have a look here at pelvic assessment. So this is a pelvic assessment setting. You can have as many settings as you'd like, because you might have like assessments that you want with certain types of reminders and follow-ups with other types of reminders. So you can choose to skip the automated email on booking, skip the 24-hour or the 2-hour reminder, and you can set a custom email reminder. If you're using the SMS, like text reminder feature, the same thing will happen. You can say, don't send the text 24 hours ahead of time, but send a text 48 hours ahead of time. Okay, so lots of functionality. You can also set your cancellation policy. So if you wanted to allow patients to cancel, what this looks like when you set it up is patients cannot cancel. Patients can cancel right up to the start of the consult. Patients can cancel up to a certain period before the consult. And then on the patient side, when they're looking at their consult on their dashboard, if you have a cancellation policy and there's a cancel option, then they could cancel on their side, right? And then down here, this account doesn't have SMS enabled, so there's no text features here, but they would just be down here if you were using our text features. Here you can see that it's a do not send, the automated reminder, rather than the do send. So by default, automated emails are going out when the consult is booked, 24 hours and 2 hours ahead of time, but you can turn those off, or you can set a custom reminder. Okay. And then the other thing that's great about consult settings is you can attach questionnaires to them. So this means that you can set it up so that certain questionnaires are going out when the consult is scheduled. Certain questionnaires are going out maybe a certain number of hours before the consult. They're going out after the consult, or a certain number of hours after the consult. So lots of functionality here, but this really helps automate your workflow so that you don't have to manually send anything or remember that you have to send things. And you can basically just group it all into your settings, and you attach that setting to your service. So when the service is booked, all the things happen for you. And then, you can use your brain power for providing your wonderful PT or other healthcare services. Also with questionnaires, you can choose the fill frequency. So if you wanted to have the patient complete it for every consult, maybe something like a COVID screen would be a good example of, I'm sure there's a COVID screen here. Or maybe a consent form. Sure. Consent form, maybe you want them to complete it for every consult. You can do that. Or if you were choosing something like patient profile information, you're going to skip if they've previously completed this. We'll choose 4 hours beforehand. Sure. Okay, so you're going to see a list 4 hours after the consult. That's fine. But basically, you can set it up the way that you want it to work. Okay. Any other questions? Oh, here we can see my conversation. Our patient sent us a message, so there's just a little ask there from the patient. Oh, Annie, will it eventually be available in French? That might be coming sooner rather than later. But I'm not making any promises. Currently, so let me back up a step. Currently, there's a Google Translate, so that does translate a lot of the platform to French, but is there going to be like an in Embodia French version? I'm going to say possibly is the answer at the moment. There's a very, and I'm going to be very honest with all of you, doing certain features or certain things like a French translation or like HCI integration is just a huge amount of work. So part of it is this debate of if we do it, is there going to be enough return, like to actually pay off the expense of having done this? So with French translation, possibly, it's just hard to gauge. We have a very large Canadian clinic that we are inching closer to them using our full practice management system, in which French is a requirement. So if that happens, then there will be sooner rather than later a French version of Embodia. The other challenge for us, which we seem to be coming closer to solving, is there's a lot of video. You may have noticed on Embodia, we have a lot of content, including exercise content. So the way that we've started to solve for this is with closed captions. We haven't generated all the French transcripts yet, but as we generate French transcripts, then there'll be the option to have closed captions in French. So maybe not like the ideal, absolute perfect scenario, but at least there will be a version of French content. But this is also fairly manual intensive work, also to make sure that when it does translate to French, that it's correct. And we're not making any odd mistakes in the translation. So I hope that sort of answers your question, Annie. If we do translate to French, we'll absolutely announce it. And the other thing, because we do have some folks in Quebec and New Brunswick who use Embodia, what they tend to lean on more is uploading their own content in French. And then, of course, you can create your questionnaires and all of your own forms in French. But yes, all of this is currently English. Any other questions? Thanks, Deneen. Yeah, it's been a journey. We've certainly grown quite a bit over the last several years, and then with the addition of the practice management system, it's become quite a large platform. Okay, Mandy, we look forward to seeing you on Monday. And anybody else who does want to have a demo and to like have more of a conversation with us about if this is the right platform for them, we are more than happy to do that, to meet with you. We definitely do not want folks signing up if it's not the right thing for them. So we don't, we're not, trying to push you towards using Embodia. What we'd like to do is just share what we have to offer. And if it's right for you, then fantastic. Then you're welcome to join. If anybody does want to sign up or have a look at the way that sign up works, you would go to your avatar and then my membership. And what's going to be outlined there is going to be, let me just see if I can log into an account that is not subscribed. What you're going to see is the option for clinic or individual. Just an important note, when you go to individual, you'll see that you can't sign up for practice management. To sign up for practice management, you do have to have a clinic account. So you just click on clinic and, sorry, back here. Oh yeah, we already have a clinic set up. So we can just simply click activate your program. So practice management, you require a clinic account because there's so many clinic features that you need. Even if you're a solo practitioner, you're going to end up with a clinic account and you can name it your name if you would like. We have lots of folks who just name the clinic account after themselves, and that works quite well. If there are any other, is the admin view? No, the admin view is different. The admin view is dependent on what the clinic manager wants to give permissions for. So again, this is a theme. There's lots of flexibility with the platform. So if you're the clinic manager, you're going to set something called permissions. There's permissions for practitioners if you have practitioners working in your clinic, and there's permissions for clinic admins. And you can set default permissions for all your clinic admins if you have more than one. And then you can set individual permissions for each clinic admin. So can they prescribe programs? Can they share education? Can they share questionnaires, manage schedules like the clinician schedules, patient billing? Can they communicate with patients? And managerial permissions would allow them to do a lot of what you do. So if you have somebody that like runs your clinic, you would probably give them managerial permissions. But we do have some guides about the clinic admin experience, and we're working on more guides for the clinic admin. Again, these are free. The clinic admin is a free account. You don't pay for these. They're just meant to help you manage your clinic and help you in your day-to-day. Wonderful. Well, thanks for hanging around, everybody. It's been a pleasure showing you a bit of what Embodia can do. There's a whole lot more depth and breadth to the platform. So I hope this was helpful. And again, if you'd like to meet with us to have a conversation about your practice, your clinic, whether this is a good fit for you, and ask more specific questions, you can schedule a demo and we'd be happy to meet with you. So I'm just going to stop sharing the screen there. Thank you again for joining. And I will send a follow-up email with just some of the links that I had put in the chat and a few helpful resources if you want to have a look at those. And as always, we are happy to help you if you have any questions afterwards. I hope everybody has a wonderful rest of their evening.